What's going on, world? Welcome. Hey, y'all already know what the deal is today. We're doing NCLEX questions. You already know what the deal is. Today is Monday. For those of you who reside in the United States and preferably in the alley of totality. Hopefully everybody had an enjoyable solar eclipse. I was in the middle of the path of totality, but there was such bad overcast that I only got a glimpse of it, but it got dark out here and it was kind of creepy. So if you've never experienced at all a solar eclipse, if you ever get the chance to experience one, no matter if you get to see it or not, you can still feel it. It affects. So definitely get the chance to do that. All right, definitely get the chance to do that. But you guys already know what we're doing. We're doing NCLEX questions. I need 100 people in here and I need 1,000 likes. I need both. If I don't got both, then I don't know what y'all want to do on this Monday. So if you guys are just now joining, or if you guys have never joined my live before, my name is Kevin. I am a registered nurse. I have been one for almost 4 years. I've worked ICU, OR, as well as PACU. I did 16 years in the Navy. My last 16 years in the Navy, I was a master instructor. So I taught a whole bunch of classes and a whole bunch of courses. So appreciate everybody being here. But of course, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that like button. You guys share, you guys follow. I need 1,000 likes and I need 100 people up in here. So what are we doing? What are we doing, y'all? What are we doing? Julia, see somebody, Julia or Jalissa. I'm sorry, Jalissa. Heather Dubose or Dubois, whichever, however it is pronounced, I should say. Hey, how we doing, y'all? How we doing? You're from Texas. Shout out to you. Is it Namuna? No, you got what I'm saying. Hopefully I didn't butcher your name. So shout out to all 18 of y'all. We're doing NCLEX questions. Hey, I need 1,000 people. I need 100 people. I need 1,000 likes. That's what I need. I failed once. That's okay. So you failed once. What are you doing to jump back forward to go take it a second time? This test doesn't determine the type of nurse that you can be. Only you can do that. You're from Nepal. Shout out to Nepal. I know Mount Everest is over there. And you guys have like one of the craziest like airports that's there that kind of goes down the hill type deal. So I watch a lot of Discovery Channel. Try to, get one with the world. Shout out to San Diego. I lived out there for almost a year. A little bit, Navy side. So what's up, everybody? Hey, I need 100 people. I need 1,000 likes. What are we thinking? You guys want these questions or not? Hey, I got some case studies. For y'all, if that's what y'all want to look at. So it takes us a little bit more time to kind of get through them. All right. So I'm going to need for y'all to be patient. Everybody comes on here, try to rush the process. That's a lot of y'all's problem, is that y'all try to rush the process like y'all got somewhere to go. And shout out to New York. Hey, everybody up in the Northeast, experienced that earthquake, that earth-shattering earthquake. So hopefully everybody's doing good up there. Hey, we got 100 people up in here. I got 700 likes. What are we doing? All right. So like I said, I do have some case studies for you guys, but it's going to take me a second to get through them. Mostly it's because with the case studies, it takes time because you have to read them, right? So I'm going to read them. I'm going to try to give as much detail as I possibly can. And, you guys start to pick your answers out from there. All right. Hey, we're almost there. Shout out to y'all. Give me 1,000 likes. We got 100 people up in here. We'll go ahead and turn this camera around. Hey, if you guys are new here, hey, this is what I do. I'm an NCLEX coach. I appreciate everybody being here. Now, hey, we're going to jump right in to the case study. All right, here we go. Hopefully everybody can see that. Hey, let me know if you guys can see that. Give me a thumbs up, because on my end, it looks kind of small. So I just want to make sure that everybody can see that. Okay. So, hey, here's our very first case scenario. Hey, so with your case scenarios, you were going to get history and physical, or you're going to get medical background of some sort, right? So the nurse is caring for a 22-year-old client who has a stab wound. So I want you to paint the picture, okay? Paint the picture of what a patient with a stab wound, where are they going to be? Probably the ER, right? So our general findings for somebody that is... Our general findings for somebody that's coming in. So a client sustained a penetrating stab wound to the neck, right upper thoracic cavity, and right lower abdomen. The client reports a sharp chest pain rated 10 out of 10. Okay. The client is alert and oriented to person, place, and time and situation, has deep tendon reflexes of 2+. What's up, Nurse Tibby? Nurse Daddy K, stop it. All right. Hey, Nurse Tibby, hey, let them know what we're doing. We're doing these case studies. All right. So the client appears to be pale, has approximately a 2-inch puncture wound to the right upper thoracic cavity, covered with an occlusive dressing tape on 3 sides that is moderately saturated with blood, crepitus. okay, and sucking sound heard at the upper thoracic wound site. Approximately 1-inch puncture wound on the right lower abdomen, covered with an occlusive dressing that has a small amount of blood. Okay, now important. This is important. Vital signs, because they're important. The key word is vital, right? So respiratory rate is 228. O2 saturation is 85 on room air, has unilateral, meaning one side, uni, meaning one, right? Unilateral chest expansion and dyspnea noted. Trachea is deviated to the left side, okay? And we have breath sounds are diminished in the right side and clear to auscultation in the left side. Other vital signs, he has a pulse of 114 and a blood pressure of 92/60. Capillary refill is greater than 3 seconds, and his ECG shows he has sinus tachycardia, and he has muscle strength that is 4 to 5 in all of the extremities. Oh, hell, I'm getting all this patient stat. That's what I'm saying, right? So now here we go. Question number 1. So here's the deal. This is what I want you to do. I'm going to go back to that scenario, but question number 1 is I want you to highlight below, aka I want you to look for 5 of the findings that require further investigation. 5 of the findings that require further investigation, meaning I need to do something right here, right now, because these things are not good. Okay, they are not good. So what are 5 things that are happening with this patient based off of this case study? What are the 5 things that I need to take care of or I need to further investigate? Let me know. My man Hunter. First of all, Hunter. Ladies and gentlemen, if you guys don't know who Hunter Helms is, my man passed his NCLEX on his second attempt, not giving up, doing his thing. Hunter, don't you think I didn't hear about you today? Don't you think I didn't hear about you today, sir? All right. So shout out to Hunter. Hunter, welcome to nursing, my good sir. You never quit. You kept pushing, and I'm proud of you. All right. Welcome to the greatest shit show on earth known as being a nurse. Sir, if there's one piece of advice that you could give to everyone out here trying to do their thing and accomplish and get this license, sir, what would it be? And once again, congratulations to you and all your hard work. Truly, truly, truly. All right. What else are we thinking? We got lateral. All right. Okay. Unilateral chest. Okay. It says, appreciate you, bro. Thank you for your support. Anytime, Hunter. Anytime. Anytime. All right. What else are we thinking, y'all? What else are we thinking about this case study? Hey, if you guys are just now joining us, we are doing an NCLEX question. Specifically, we are doing a case study. Case studies, all right? Case studies are actually a part of the NCLEX, all right? These are how the questions are going to be asked of you. And you, as the student, need to be able to critically think in order to make a clinical judgment. All right. It says we think in chest tube stat. All right. I'm going to give you guys 15 more seconds. These are a lot longer, so I want you guys to really jump into that. It says, what was the respirations? Respirations are right there. 28. Respirations are 28. O2 saturation is 85. All right. All right. Here we go. Let's see what the answer is. Let us go to our answer in 3, 2. All right. So our very first thing that the patient appears pale. Okay. They have an O2 saturation and a respiratory rate that is on room air. Well, the O2 saturation is at 85 and the respiratory rate's at 28. So that's something that requires our attention. The unilateral chest expansion by breath sounds are diminished in the right side. The pulse is 114 and the blood pressure is 92/60. Those are the things that require further investigation by us as the nurses. All right. By us as the nurses. All right. So findings that require further investigation in a client with a penetrating stab wound to the neck, chest, and abdomen include the unilateral chest expansion and diminished breath sounds, which indicate the presence of air or an open pneumothorax or fluid in the pleural space, which is a hemothorax or pleural effusion. The vital signs are unstable, such as the patient having tachycardia, hypotension, tachypnea, and hypoxemia, and signs of poor perfusion, aka skin pallor, which means this patient is pale, which are concerns for hemorrhage and respiratory compromise. Okay. Hey, so like I said, these are going to take a little bit more time. All right. These are going to take a little bit more time because it requires you guys to read it. All right. So hey, if you guys are just now joining, we are doing a case study. We're doing a case study. All right. Case studies are important because they will be asked. You will get asked at least 6 of them that will have all the information that you need. Okay, so I want you guys to be aware of that. So here we go. Here is question number 2. All right, so based off of all of that information, all right, based off of all of that information that we just went through within the case study, I want you to specify the findings that is consistent with the disease process of a hemothorax or a tension pneumothorax. All right, so I need to know tachycardia. Does that correlate with a hemothorax or attention pneumothorax, hypotension, subcutaneous emphysema, or unilateral diminished breath sounds? All right. I need to know what goes where. What goes where? What are we thinking? I need to know what goes where. Here, I'm going to do this. I'm going to take it back up to the case study. All right. So here is the case study. All right. Hey, if you guys are just now joining, we are doing a case study for NCLEX. All right. We are doing a case study for NCLEX. You will get at least 6 of them. You will get at least 6 of them. All right. Nurse Tibby, I appreciate the hard hands. Thanks so much. I appreciate you as always. So based off of our case study, what findings go where? All right. I'm going to give you guys 30 seconds. All right. Shout out to 36 of y'all. Usually I have hundreds of people in here, but I guess no one, I get asked all the time to do NGN questions or to do case study questions. And then the time I do it, no one's here. Oh, I appreciate y'all being here. All 36 of y'all. Y'all are the real ones. All right. Y'all are the real ones. All right. So hypotension, what's hypo mean? Low blood pressure. So what am I thinking? What am I thinking if I have a low blood pressure? Buddha baby, oh, you here? I appreciate you being here. All right, y'all, let us see what the answer is. Hey, I need for y'all to let me know what these answers are. Y'all got to let me know what these answers are. But here we go. Here we go in 3, 2. The answers go as follows. So with tachycardia, they both correlate with a hemothorax and attention pneumo. With hypotension, they both go with hemo and attention pneumo. Subcutaneous emphysema is seen with attention pneumothorax. Right? Subcutaneous emphysema is where we get air trapped under the skin. It's kind of what we call the Rice Krispies. Right? Okay, that's part of the tension pneumo, right? And then we have unilateral diminished breath sounds. Where and what type of information can I see that in? I can see that in a hemothorax as well as a tension pneumo. Okay, so a hemothorax results from the accumulation of blood in the pleural cavity. This can lead to loss of intravascular blood volume, causing tachycardia and hypotension. Accumulation of blood in the pleural space compresses underlying lung alveoli, resulting in diminished breath sounds on the affected side and dullness with percussion. Now, with a pneumothorax, it is characterized by air inside the pleural space, which disrupts the negative pressure that maintains lung expansion, causing the lungs to collapse either partially or completely. Tension pneumothorax develops if air enters but cannot escape the pleural space. The increased positive pressure compresses the heart and great vessels, inhibiting venous return and causing decreased cardiac output and hypotension. Okay. The pressure also shifts the medial sternum and trachea towards the opposite side, which will cause tracheal deviation. It says, I need to hit the book. I need to hit the books because, oh boy, Allie, I'm letting y'all know. I get asked all the time. These aren't NGN questions. I love it how somebody tells me what an NGN question is when they've never taken the exam. But I'm telling you that these case studies, you will get a lot of them. All right. You will get at least 6 of them. All right. Now, I'm just letting y'all know. Participation is the key. Y'all let me know. Y'all let me know how y'all feel about this. All right. Y'all let me know how y'all feel about these questions. OK, here we go. So now we're going to go to question number 3. But first, let's go back to the case study. All right. Because every single question that you get, the information is going to come from this case study. All right. All right. So remember, he had a stab wound, right, to the upper right, was it right upper thoracic and right lower abdomen. He has 10 out of 10 pain. Right, he's A&O times 4. He's pale. He has a respiratory rate of 28, O2 at 85. Blood pressure is 114. I'm sorry, blood pressure is 92/60. Pulse is 114. He has a sinus tachycardia on an EKG. Right, so that's the those are important things that we need to know. Now, based off of that information, the nurse recognizes that the client is most likely experiencing what? What do you think that the client is experiencing based off of everything that we talked about? Is it a flail chest, air embolism, tension pneumothorax, or acute respiratory distress syndrome? What do we think it is? What do we think it is? Shout out to all 30 y'all out here rocking. We're doing NCLEX questions specifically. We are doing a case study. The case studies will 100% be on your exam. Doesn't matter if you're an RN or if you are an LPN. They will be on there. You will get at least 6 of them. Out of 6 case studies, you'll get Out of 6 case studies, you'll get at least, no, I'm sorry, you'll get at least 8 of them. And out of 8 of them, you will get 6 questions per case study. All right. 6 questions per case study. Some people I know, they've gotten a lot more than that. I'm just saying, just be aware. This is what is going to be given to you. The NCLEX wants you to use your critical thinking in order for you to make a clinical judgment. All right. All right. Hey, and here's another thing too. I'm doing a live 3-day NCLEX review, April 12th to April 14th, which is this coming weekend. All right. So Friday, starting at noon to 5, we're going to be going through everything that you need to know for the NCLEX, to include going through some questions, right? And then some hot tips, those things to remember to never, ever forget while you're studying for your NCLEX. Okay. And we're going to, on the 13th and on the 14th, 9 to 5, baby, 9 to 5. It's not like a shift where we're going to be doing 9 to 9, because that would be terrible, right? But you are correct. The answer is C. It is a tension pneumothorax. Okay. And open pneumothorax is caused by an opening, such as the penetrating stab wound in the chest wall, which allows air to enter the pleural space. A tension pneumothorax is a life-threatening emergency that develops as air becomes trapped in the pleural space, compressing the heart and great vessels and displacing middle structure, such as the trachea, to the opposite side. Additional signs include unilateral chest wall expansion, diminished breath sounds on one side, and vital sign instability, such as your tachypnea, your hypoxia, your hypotension, and your tachycardia. All right. So shout out to everybody that got that question right. That question that was just that we just went over, that's what they call a closed drop down. All right. So when you click it, it'll drop down. It'll show you all your answer choices. You pick one. All right. And that's essentially kind of like fill in the blank, but you don't have to type it out. Okay. So shout out to everybody who got that one right. All right. Now, once again, all the information comes from this scenario right here. Okay. Once again, let's talk about it. He had a stab wound, upper right thoracic cavity and right lower abdomen. He has 10 out of 10 pain, oriented A&O times 4, right? He's pale. He has tracheal deviation, small amounts of blood at the occlusion site, respiratory rate 28, O2 85 on room air, pulse 114, blood pressure 92/60, and the EKG shows he's sinus tachycardia. Okay. So with all of that information, which of the following interventions does the nurse anticipate next? So what do you think is the next step in the process of taking care of our patient? Remember, he got stabbed. He got some bleeding going on. What do y'all think it is? All right. Is it a blood transfusion? Is it a chest tube insertion? Is it endotracheal intubation? Or is it arterial blood gas analysis? What are we thinking? Shout out to everybody that's just now joining. We are doing NCLEX questions. Specifically, we're doing a case study. This was highly requested. Highly requested. All right. If you guys are finding value, make sure you guys like, share, you follow. Also, I want to know who you are, where you're from, where you're at in your nursing journey. Where are you in your nursing journey? All right. A little bit about me. Hey, there's another thing, y'all. I failed my NCLEX. 3 times. 3. If you're new here. And if you didn't know that, then hey, now you know. So, because one thing I'm going to tell you, this exam does not determine what type of nurse that you're going to be. Only you can do that. Only you can do that. All right. Get out of your own way. Get out of your own head. All right. This test has no type of emotional ties to you whatsoever. So stop giving it all your emotions and being scared of it. Just graduated, studying to take the NCLEX. Shout out to you, Jazz. Shout out to you. All right. Here we go. Let us see what the answer is. In 3, 2. And the answer indeed is 2. It is 2. What was number 2? Chest tube intubation. There we go. It was chest tube intubation. All right. Or chest tube insertion. My bad. A, tension pneumothorax is life-threatening and requires immediate chest tube placement to decompress the pleural space, promote re-expansion of the compressed lung, relieve compression of the heart and great vessels, and restore hemodynamic stability. The chest tube should be connected to a water seal drainage system and suction, which promotes evacuation of air and reestablishment of negative pressure in the pleural cavity. The water seal acts as a one-way valve, allowing air to exit the pleural space but not enter it. And that is why answer number 2 is the correct answer. Now, I know some people, did I see somebody put number 3 in there? Because we're always talking about airway, but it says, endotracheal intubation would worsen the existing pneumothorax by delivering positive pressure ventilation, right? Doesn't matter, because guess what? There's still positive pressure going in the negative space which is coming from outside. It's outside atmospheric air. And if I'm pushing positive pressure endotracheally, it's not gonna work. It's just like they're not gonna work. It's not gonna work. It's counterintuitive. Okay. So shout out to y'all. Shout out to y'all. Now let us go to question number 5. All right. Now here's question number 5. All right. Now, if we go back to the scenario, if you guys are just now joining us, we are doing NCLEX questions. Specifically, we're going over a case study, trying to essentially go more in depth. And I want you all to see essentially what you guys are going to be exposed to. You're going to get all the information that you need. There's not going to be any guessing. There's not going to be any guessing. All right. You have all the information that you need. You have a patient that got a stab wound to the neck, to the upper chest, and to the lower abdomen who has a 10 out of 10 pain. He's alert and oriented ×4. All right. He's pale. He has blood at his occlusive dressing. He has sucking and crepitus sounds heard in his upper thoracic wound. He has unilateral chest expansion. Respiratory rate is 28. O2 is 85 on room air. Right. He has tracheal deviation. Doesn't matter what side. He has tracheal deviation, which is not good. Right. And diminished lung sounds in the right and clear on the left. Pulse is 114. Blood pressure is 92/60 with a cap refill of greater than 3 seconds and a tachycardia, sinus tachycardia on the ECG. Now, with all that information given to us, we'll go back to question number 5. All right, the nurse is assisting the client with repositioning in the bed after the chest tube becomes dislodged from the client's chest. Which of the following actions should the nurse take first? So what is the very first thing that the nurse should do? When, hey, I pulled the chest tube right out of somebody's chest, what's the very first thing do I do? All right. Do I want to measure his O2 saturation? Do I want to call a rapid response? Do I want to cover the insertion site with my palm glove, or do I want to administer O2? It says yell at the new nurse. Stop it. That we can't yell at the new nurse. Tibby, you know better. You know better. Madam. Katie says 3. Okay. Is it Rose? Is it Chow Rose? You know what I'm talking about. She says 3. Okay, cool. I West got 3, 3, 3. Okay. Man, now everybody want to answer. We go to the harder questions. Everybody's just like, nah, bro, I don't know. That's okay. I would never. I know you would never. I know you would never. I know somebody tried me and they didn't try me after that. I don't know why. But ladies and gentlemen, of course, while you guys are answering this question, I'm doing a live 3-day NCLEX review on the 12th and to the 14th, which is this coming weekend. You guys can check it out, thebootnurse.com/review. You guys get to hang out with me for 3 days while we go through NCLEX questions, as well as how the NCLEX is structured and, helpful ways for you guys to remember those important questions when they come up. All right, let's see what this additional information is. Let's see what we got. All right, so we got some additional information. All right, so let's see what our lab values look like. So our hemoglobin, right, is at normal. Here's our normal hemoglobin. On NCLEX, they will give you your lab values. They will give them to you, all right? But hemoglobin at 2115 is 10.8, all right? That tells me what? That it's not good, right? Hematocrit is at 30%. Normal is 42 to 52, 37, 47 for women. Do not get all hung up on that. Do not get all hung up on the fact that, oh my God, that it says it's 36 somewhere. Listen, obviously we know that 30 is not good, okay? So we have diagnostic results. So at 2115, which is 9:15 if you guys don't know military time. Chest x-ray reviews, accumulation of blood in the pleural space and tracheal deviation in the left. Findings are consistent with a tension pneumothorax, and that's what we talked about earlier. 2130, chest tube insertion into the right pleural cavity at the fourth intercostal space. Client tolerated the procedure without difficulty. Dressing is clean, dry, and intact. Vital signs now are pulse is 89, respiratory rate is 18, blood pressure is 112/74, and O2 saturation is 94% on 2 liters via nasal cannula, and now he has a normal sinus rhythm. Now, with that information given to us, what would we do? What will we do? And I think everybody said it, is that we would cover the insertion site with the palm of a gloved hand. That's exactly what we would do, right? So sudden removal of a chest tube can worsen or cause a new pneumothorax. During a planned removal, clients are instructed to inhale and pause just before the chest tube is withdrawn, then exhale after removal is complete, and the site is covered. By pausing respirations while the lungs are inflated, the client is able to increase endothoracic pressure and prevent air from entering the pleural space. The healthcare provider then closes the insertion site with a purse string suture or applies an occlusive, or a petroleum gauze dressing while the client maintains the thoracic pressure. All right. So that's very, very important of why we do that and why we need to understand it. If a chest tube is accidentally dislodged from the chest cavity or from the client's chest, the priority is to cover the insertion site to prevent atmospheric air from entering the pleural space. Ideally, a dressing such as an occlusive dressing or a three-sided gauze is placed over the site immediately to prevent a tension pneumothorax. However, if the nurse does not have immediate access to dressing supplies, the priority is to place the palm of a clean gloved hand firmly over the site until a dressing can be obtained. Right? Cover, exactly. Shout out to all 44 of y'all. Hey, if you guys are just now joining, we are doing NCLEX questions. Specifically, we are going through a case study. All right? This is what you need to know on NCLEX. They will give you tons and tons and tons of case studies. They can give you 6 questions out of one case study. 6 questions out of one case study. All right. So make sure you guys are paying attention to that. Remember, the NCLEX wants you to use your critical thinking so you can make a clinical judgment. Listen, they give you all this information because you need to know what is happening when a patient has these vital signs right here. If they're trending down, you need to know if these are good or if these are bad. And if they're good or if they're bad, what do you do? All right, if I look at this blood pressure, I'm like, okay, we're having hemodynamic instability. So they're bleeding out somewhere. Are they in some type of shock, like anaphylactic shock, right? This is not a sustainable pulse. The reason why the pulse is so high is because this is so low. And now this is letting you know, like, hey, what's going on? Not enough oxygen. I'm breathing too fast because I don't have this much. Everything, they all correlate and work with one another. Okay. So let us go back to question number 6. Now, the client's chest tube is reinserted and connected to a new water-sealed drainage device. Which of the following observations would require follow-up? Select all that apply. These are going to be multiple ones that you're going to pick. It could either be one, a few of them, or all of them. But it is rarely ever one, and it's rarely ever all of them. All right? So based off of that, what are we thinking? What requires follow-up? Something is wrong or something that is happening that is incorrect. And we as the nurses need to fix it. So does it require follow-up if there's continuous bubbling in the water seal chamber? Does it require follow-up if 150 mLs of sanguineous drainage 1 hour after chest tube insertion is happening? Right? Does it require follow-up if the water levels in the water seal chamber rises with inhalation and falls while exhalation? Does it require follow-up if there's diminished breath sounds on the right side of the chest? And or does it require follow-up of the pleuritic chest pain on a deep inspiration? What are we thinking? If any point in time you see a select all that apply or any question that says, does it require follow-up? Read it that way. I don't know. Just be like, hey, does it require follow-up if, and then read the answer. Okay. Man says 1, 2, and 4. Rose says 1 and 4. Bree says 1, 2, and 4. I say 1 and 4. Okay. So what else are we thinking? Hey, if you guys are new here, welcome. We are doing a case study for NCLEX. Either it be for RN or LPN. Either one, it doesn't matter. It does not matter. And here's another thing on select out of apply. If you don't know, don't pick it. If you do not know, do not pick it. This is something that I tell everybody when I do one-on-one coaching with them. If you don't know, don't pick it. Okay? There's nothing wrong. The great thing about getting it wrong here is that you understand why you got it wrong here. I'd rather you get it wrong here than get it wrong somewhere else. All right? I'd rather you get it wrong here than get it wrong somewhere else. Okay? So what are we thinking? So based off of our case study, I got 1, 2, and 3, 1 and 2, 1, 4, and 5. Okay. I'll give you guys 10 more seconds because I know some people are still trying to jump in here. Make sure you guys like, you guys share, and you guys follow. All right. That's the trifecta. If you're in nursing school right now, what are you doing? And you haven't shared this with nobody being out here being greedy. It's terrible. You should be ashamed of yourself. All right, y'all, let us see what the answer is. What is the answer in 3, 2? All right, so the correct answers are 1 and 2. These are the ones that require follow-up. 1 and 2 require follow-up by the nurse. Now let's see why. Let us see why it requires follow-up. Listen to me. If you are not reading your rationales, if you are studying for this exam and you are speeding your way through it, I'm going to need for you to fix yourself. I don't understand why any of you are trying to rush this process like you got somewhere to go. Stop trying to rush the process, okay? Understand the question, understand the answers and the rationales, all right? And if you don't know it, keep going through it, all right? Stop rushing. You get 5 hours to take this exam. A lot of y'all are just like, oh, I got to get up and I got to get out. No, take all that time that you need, all right? So when caring for a client with a chest tube, the nurse should monitor for continuous bubbling in the water seal chamber, which indicates a leak. Now, if you hear continuous bubbling in a sealed anything, that is not good. So think, if I hear continuous bubbling with seal, no, that's not good. All right, and that can indicate an air leak. A water seal chamber prevents air from flowing into the client. Intermittent bubbling, all right, during expiration is expected in the water seal chamber until the pneumothorax is resolved. However, continuous bubbling indicates an air leak. All right. Continuous gentle bubbling is expected in the suction control chamber. All right. In the suction control chamber, which maintains and controls suction to the chest drainage system. All right. I want bubbling in my suction control chamber. I want it there, but I don't want any bubbling in my water seal chamber. All right. Understand the difference. Trust and believe me, you may see a question that pop up on your NCLEX like this. You most definitely will see it while you are practicing. This is why I just took my NCLEX Saturday and had that exact question. Look at that, Cassie or KC. Girl, you know who I'm talking. You know I'm talking to you. Just worded very differently. Exactly. There's only so many ways that we can write an NCLEX question, right? There's only so many ways that we can do it. But it's very familiar. And look at you saying like, oh, that's something that I had last week. And you may or may not see it somewhere. All right. The presence of excessive blood, meaning greater than 100 mLs an hour of sanguineous output in the collection chamber, would indicate possible hemorrhage from the stab wound or a complication of chest tube insertion, aka lung rupture. All right. And that's not something that we want. And so that requires follow-up by the nurse. All right. So shout out to everybody who got that question right. Now, let me tell you something. Here's the thing. You got to go when you guys are getting your case studies. You have to read them. Stop rushing through them. You ain't going nowhere. If you work that day, I suggest you take that day off. You're going to need it because you're going to be an emotional wreck for whatever reason. Right. So take the time to read this. Take the time to read them and understand them, right? If I have somebody that's pale, that's telling me that they're having a hemodynamic problem. There's no blood there's no O2, there's no oxygen carrying red blood cells inside. Like I'm losing them. That's why I'm pale, right? And I'm pale. Why? Because I'm losing volume. All right. I'm pumping all this out and I'm losing volume. I have no oxygen because I'm losing it, right? I'm breathing so fast. Why? Because it's this. Everything is connected. Good evening from Washington, D.C. Good evening from Texas. All right. So make sure you guys are understanding what is being put down when you are studying for this exam. OK. Of course, ladies and gentlemen, I got some free test taking tips that you guys can check out. Those links are in my bio. This right here is 42 pages, y'all, 42 pages, and it's free. You guys can go over there and you guys can check that out. Go over there and download it. Hey, it is beyond helpful. I've gotten so many messages saying that they love it and it's very helpful for them. And if that's something that you need, that is something that is available to you. Also, I have an ebook that you can check out and you can purchase it. It's $29. And it's over 700 pages of just awesomeness that's in there, aka we talk about EKG interpretations. We talk about pharmacology, delegation management and supervision, growth and development, all the important things that you need to know. And it's over 700 pages. I kind of went overkill, but a lot of people are telling me that they like overkill and they'd rather have it than not need it, than need it and not have it. So you guys can check that out as well. If you want to join my on-demand NCLEX course where I have 2 different NCLEX reviews, apart from you get to be a part of my NCLEX community where it's like Facebook, but it's not Facebook. And I do live reviews in there where I break down questions and we go over lectures. You guys can be a part of that. You can join the 7-day NCLEX course for just $7 for 7 days. It's a 7-day trial for $7. If you like it, it's on a monthly subscription of $97. If you don't, you can cancel it anytime you want. And that's right there at thebootnurse.com/special. And last but not least, if you are one of those individuals who have not done well on the NCLEX, you failed, or you're nervous, or you don't know where to start, you don't understand how to break down NCLEX style questions, you don't understand content or how to apply them. Are you nervous? Do you not have a schedule? Do you not know how to follow it? Do you not know where to put anything into place for yourself and you're looking for help? Hey, I'm not just like Nurse Amber. I am your guy. I'm an NCLEX coach and a mentor, and I help people conquer their NCLEX. Why? I failed my NCLEX 3 times, ladies and gentlemen. So why would I not want to help you? All right. And if you're interested in that, you can check that out at thebootnurse.com/coaching. All right. I have a 100% pass rate. Ladies and gentlemen, I have a 100% pass rate, and that's no BS. And I've been coaching for 4 years. Every single person that I have coached has passed the NCLEX, every single one. All right. So if you want to be a part of the Boot Nation and be a boot nurse, which I want everybody to do, and I want everybody to get that license, go over there and check that out. All right. And everybody needs something different. Some people need more. Some people need less. Some people need more time. Some people need less time. So it all just depends. Everyone is tailored to you. I only take 5 students at a time, or 5 students per month. Once I hit 5, I don't take any more. All right. I don't take any more until people start testing and they pass. I got one taking one this week, another one taking one, another one next week, and then the one following week. And I had one last week that just got her license on her 5th attempt. All right. Samantha, you did miss it. I went over a case study. For sure. So make sure you guys go over there and check that out. Those links are in my link tree and in my bio. And lastly, I am doing a live NCLEX review. By the way, I've been getting Samantha, you're okay. I've been getting a lot of requests about doing an NCLEX review in May. Well, there will be a wait list that is going to go up inside of the link tree in my bio for those that are interested in doing NCLEX review with me in May. I'm going to be doing it twice. No, I'm going to do it 3 times in May. It says just share all your links on your Facebook. All my links are on my Facebook. The link tree is there too. So I'm going to be doing 3 NCLEX reviews in May. At the beginning of May, middle of May, and then at the end. So it's going to be the 31st, then the 1st, and then the 2nd of June. All right. So I'm going to be sending those out. If anybody is interested in wanting to be a part of that, we're going to do a 3-day live review. We're going to break down new generation NCLEX questions, just like I did for you today. We're going to talk about test taking strategies, things that you need to remember, and things that are prominently that are going to pop up on the NCLEX. You guys, if you decide to be a part of the review, you guys will get the NCLEX Victory Guide, and you'll get 90-day access to the 7-day NCLEX course as well as the community. All right. So you guys can also 100% be a part of that. You don't get my head cover. Somebody was like, hey, where can I get that head cover? Somebody made it for me. So sorry. But yeah, so I'm going to be doing that April 12th to April 14th. It says, do you pick students online? What do you mean? Do I pick students online? Doll 2000. Do I pick students online? But yes, so you guys can go over there and check that out. It's thebootnurse.com/3-day review. And even if you don't feel like you need it, send it to somebody. They may need it. You never know what people may need out here. Okay. And if you guys like how I do things on TikTok, you guys are going to love how much more in depth I'm going to go when we do our NCLEX review. All right. It's over 3 days. So it's going to be jam packed full of just greatness. Okay. So of course, ladies and gentlemen, that wraps up today. I only went over one case study because I only had one case study to really go over. Well, I had some more, but I didn't have them all set up. But anyways, so I went over a case study. I appreciate all the love, all the likes. Hey, like I said, we're going to be doing a live review on the 12th, 13th, and the 14th. You guys can check out the NCLEX review, as well as if you need coaching and you want to know one-on-one, check that link in my bio. I would like to be your student, but I am in North America. Where in North America? I live in Texas, so I live in North America too. So you either live in the United States, you live in Canada, or you live in Mexico. Which one? Or you live in Panama or Honduras, or you know what I'm talking about. So unless that's part of South America, which I don't think it is, but Canada. Okay, that's cool. Is the live review already booked? What do you mean is the live review already booked? As in, like, can you go and join it? You can go and join it for sure. Yeah. I'm only taking a small amount of people. I'm only taking a small amount of people because I want it to be very intimate and personal, right? Can we still join it? Yes, you can still join it. There's still room. I have not closed it yet. I don't plan on closing it until right up until the end. So, but I'm only going to be taking about 20 to the 30 people. I'm not going to be taking like 200 people because I want people to engage. I want to be able to give everybody what I can. So it says, hey man, I miss the tonight's review, help with the kids. Rabbit, it's all good. It's all good, Rabbit. I appreciate you. It says, Nurse Addie K, great job as always. Ma'am, Nurse Tibby, I appreciate you. But hey, so what I'm going to do is I'm going to turn this camera around and I'm going to be answering some of y'all's questions. I know I'm kind of got some hair stuff going on right here. But what's up? Hey, so what questions do you guys have? What questions do you guys have with regards to NCLEX, with regards to nursing? If you guys are just now joining, my name is Kevin. I've been a nurse for almost 4 years. I worked ICU, OR, and PACU. We just got finished going over a case study. Hopefully everybody really appreciated that. If you guys did, make sure you guys smash that like button. Make sure you guys share and you guys follow. And let other people know that I do these NCLEX questions. I do them every Monday, Wednesday, and Friday at 5:30. Okay, so what other questions do you guys have? Speaking of that, did anybody enjoy the eclipse today? I didn't because I had overcast. I mean, it got dark out here and I felt some kind of way about it. But it was such bad overcast, I didn't get to see the whole thing happen. It just was just ambiance outside. So what are we thinking? It was a dud here. I bet. It was a dud here in San Antonio because it was just overcast everywhere. It says, I didn't see it here in Florida. Well, that sucks. I know places that they only got like a sliver of it. I mean, I guess it's okay. So I did hear that the next one in the world is going to be that, where people can view it is going to be, I think, in Spain in 2026. I don't know if you want to be a part of that, right? So, but if you guys are just now joining, I want to know who you are, where you're from, where you're at in your nursing journey. What questions do you have about NCLEX on this Monday morning, or Monday morning evening, I should say. And like I said, a little bit about me. I've been a nurse for almost 4 years. I worked ICU, OR, PACU. I did 16 years in the Navy. I just got out this past January. So I'm a full-fledged veteran, which is weird. But, and also I failed my NCLEX 3 times. I failed it 3 times. 3. And let me tell you, nobody cares. Nobody cares how y'all feel about y'all failing the NCLEX. You know who will never ask you? Your job and your patient. They'll never ask you. Or your client, according to NCLEX, right? They'll never ask you. You are going to be a shitbag regardless if you are terrible. I've seen some of the worst nurses that pass NCLEX once, and I've seen some of the most phenomenal nurses I've seen pass it multiple times because it doesn't matter. It matters because it shows that you have basic competency to pass this exam, because it indeed is basic competency, but it doesn't determine what type of nurse that you're going to be. It does not. All right. So you have to get out of your own way. You have to get off your beach, so to speak. Get off your beach. Either you're going to stay on the beach, you're going to get beat up, you're going to just take the gunfire, or you're going to run straight through it and just let life hit you. You're going to let life bounce off, and you're going to keep pushing forward. Nairobi says, hello, I'm Barbara from New York. It is my last week of finals and hopefully graduate May 10th with my BSN. So we don't say hopefully. You already put in the work. You already know you're going to graduate. Put it out into existence. Speak it out to the universe, and it shall be so. Speak it out into the universe, and it shall be so. I know some terrible nurses, too. They inspire me to do better. I hope so. I really hope so, because I'm telling you right now, I would never want to be like I never aspired to be a nurse and wanted to see some of these people that were just terrible and that they lost their emotional connection to wanting to be a nurse. Because, I mean, you have to have some type of emotion to take care of people. The moment that your emotions start to go out the door and you start to become numb to all that, it's time for you to do something else. Not, maybe not bedside, but you could do something else. It says, is there a certain time or season for new grads to be hired? Nope. They hire new grads all the time. They hire new grads all the time. It says meaning residency or cohort. So usually they do like residency and cohorts and stuff like that, like every 3 months. So you could graduate in March and then they'll be like, hey, you ready in May? or hey, you ready in April? And then next thing you know, they'll do it again in June. They'll do it again in September. They'll do it again. They do it all the time. How long should I go? How long should I take to go for my NCLEX after graduation? What do you mean? Like, how long should you study before you go and take your NCLEX? If you're coming right out of school, you should take it ASAP. ASAP. Take it ASAP. Because you have all that information that's still in your head, right? The longer it takes, or the longer you take to go sit for your exam, the more information you're going to start to lose, because you're going to stop caring. You're going to be like, oh, I'm free. I'm out of school. I'll study for NCLEX whenever. Next thing you know, you're going to forget everything. All right. So usually that usually takes within 30 days. Usually. So it's like when you graduate, authorization to test comes through, then you gotta reserve a seat. So that's usually within 30 days. So crash creation? Yeah, so it's usually within 30 days. Usually within 30 days. That was a good question. What other questions do you guys have? Hey, if you guys are just now joining, we did a NCLEX case study. I only did one because apparently people asked for it, and then the moment I give them a case study, they are not about it at all. But I think I had like 30 or 40 people in here, but hey, 30 or 40 of y'all, hopefully you guys got something out of it, because case studies will be on there. 100% they will be on there. All right. They did get scared. It seemed that way, right? Because usually I have like 200 or 300, 400 people on here. And then the moment I go over a case study, I'll be like, nah, bro, I don't want to be a part of that. All right. But hey, don't run away from the real reality of these case studies. Okay. It's better for you to understand. It's better for you to understand them here and ask your question by somebody who has gone through tons and tons of them and to help you break them down, rather than you just run away from them. Doll 2000, how long should I take studying if I have 2 years after graduation? If you have been out of school for quite some time, if you come up with a really good test plan for yourself, a study plan, if you have really good time management, if you're disciplined, if you have a support system that's really good, although that's not required, that's always great. If you really buckle down, you could be prepared in 30 days. 30 to 45 days, but no longer than 90 days. If you're studying longer than 90 days, you're doing something wrong, and I'm going to need for you to fix that. I've had people that have messaged me, like there's one young lady that I coached. She failed to 11 times and passed on her 12th. Right? I worked with her for right around a little over 30 days. And she passed on her next attempt. So I had another young lady who failed 4, passed on her 5th. Another one who failed on her 3rd, passed on her 4th. It all just depends. But bare minimum, if that's the case for somebody who's been out of school, you need 30 days. I had a lot of bow ties. So you had a lot of bow ties, which means you had a lot of case studies. Let them know. If you've already taken the NCLEX, let them know. What's up, Mel? Thank you for the roses. I appreciate you. Thank you. You're awesome. Miss Anti-Aging Skin. Hey, if y'all want to really know about some skincare and have it backed by doctors and pharmacists, hey, go check out Anti-Aging Skin and Hair. Should get you looking right. Get you looking right. All right. All is well. How are you? You already know me. I'm out here trying to win hearts and minds, and I want people to go out there and be the best soon-to-be nurses that they can be. I'm 3 months out from graduating. So if you're 3 months out for graduating, you should start being very, very familiar with the process of studying for the NCLEX. All right. Now, if you're 3 months out from graduating, because we're already in April, so that means you graduate May, June, July. So you graduate end of July, beginning of August timeframe. Probably about a month and a half from graduating, you need to be on it. It says your program is the truth. I passed because of you. Thank you. It was a creative-ish, ma'am. Thank you so much. I appreciate you. Hey, let them know about my 7-day NCLEX course program, about the reviews that are in there, about the content that's in there, about what else is in there, about how with the community, how I do live lectures and live breakdowns of questions. Let them know that I do all that stuff. All right. And I appreciate you. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give, what would it be? And of course, ma'am, I appreciate you and welcome again to nursing. Also, if you're using the course, go to the community, go to share your wins and drop your win in there and tell everybody about it. Okay. So what advice would you give? Anti-Aging says, thank you. So appreciate your support. Of course. Absolutely. Hey, if you guys are just now joining, we did a NCLEX case study. It was both for RNs and LPNs. RNs and LPNs, all right? Because case studies are the bread and butter, all right? They'll still give you multiple choice questions. They'll still give you select all that apply. But the case studies, you have to be familiar with them. You have to be familiar with them. All the information is there, and you have to know how to apply it when it's coming to making a clinical judgment, okay? So what other questions do you guys have? This is going to be a short live today on this Monday. Usually I'm going like an hour, almost 2 hours, but it looks like the live is going to be short. What are we thinking? What questions do you guys got? Hey, if you guys don't got no questions, I'll leave. All right. What are we thinking? Like I said, hopefully everybody had a really good weekend. All right. I keep forgetting that today is Monday. Hopefully everybody had a really good weekend. Make sure if you guys are interested, we are doing a live NCLEX review, which is going to be on, when is it going to? It's going to be on this coming Friday, right? We're doing a live NCLEX review. Let me back that up. We're going to be doing it live on April 12th, 13th, and 14th. It's at thebootnurse.com/3-day review. All right. A lot of people was asking me, is it free? It indeed is not free. It is $197. You only have to pay at one time, and you get 90-day access to the course as well as the community, as well as you get my ebook, which is over 700 pages. And of course, and you get the live replay. You get a live replay of the review also. So, and if you're interested in something else where you need a lot more, where you need a little bit more attention, you want something one-on-one, you want to be able to, sit and talk with me for, hour and a half, 2 hours once a week. And, I really, really dive into making sure that you are successful. You can check out thebootnurse.com/coaching. And fill out the questionnaire. Once you fill the questionnaire out, schedule a call with me and let us see if coaching is right for you, because coaching is a relationship, ladies and gentlemen. It is a relationship, okay? And I want to make sure that our relationship is going to be a plentiful one, because I have 100% pass rate when it comes to coaching. Every single person that I have coached for NCLEX has passed it, every single one. And if you guys got any questions about them, you guys can check the testimonies inside of my on my main page, okay, about people who have passed, especially my young lady that passed on her 12th attempt. So that's real. That is the real deal out there. All right. So before, oh my God, I put the wrong one on. Oh, I thought I put mirror on. It made my jaw look all like. But what other questions do you guys have? What other questions do you guys have? All right, cool. Well, it says, I sent you a message. Oh, okay. So if you guys don't have any other questions, I'm going to log off the live tonight. Like I said, it's a really short live today. I wanted to go through a case study. But I appreciate all 21 of y'all out here rocking. Make sure you guys take care of yourself, because if you don't take care of yourself, you can't take care of nobody else. I think we could all agree with that, right? Oh my goodness, what is going on here? Anyways, so hope everybody has a really good next couple of days, and I will see everybody on Wednesday.